September is Childhood Cancer Awareness Month, and according to some reports, some cancer rates are rising amongst our youngest people. And joining us this morning is Dr. Toni Peters, Pediatric Oncology at Gundersen Health System. Good morning, Toni. Welcome to Daybreak.
Thanks for having me. Happy to be here.
So, Dr. Peters, being it's Childhood Cancer Awareness Month, what do you want parents and young people to know about cancer?
Well, I think what's probably important for people to know is that in general, childhood cancer is pretty rare compared to how often you see cancer maybe in adults, especially older adults. But it's not that rare. It's about 1 out of every 300 children will be diagnosed with cancer before they reach the age of 20. And so it is something that, even if it doesn't affect an immediate loved one or someone in your family, you will see it in your community. Your children may have classmates who have been diagnosed with cancer. And I think the good news about childhood cancer is that we are actually quite effective at treating it, curing more than 80% of children diagnosed with cancer. But it's still an extremely difficult diagnosis that affects the entire family and obviously creates lots of stress for everyone around the situation.
I understand that Gundersen, you have a program in place for pediatric cancer patients, and it's called Courage. What is that, and how does that help children affected by cancer?
So Courage is a program that consists of our staff here at Gundersen, but also the parents, family members, and even our patients who are affected by cancer. And the primary goal of Courage is to do events where we raise awareness of childhood cancer, and perhaps provide some things for families where there's a new diagnosis in the family, some care packages and things like that. So the next event we have coming up is going to be that we will be walking in the Apple Fest parade in the Crescent here later in September. And our families all really love those types of events, and to be able to get out into the community and show that they may have this diagnosis, but they're still going strong.
Okay, sounds great. Sounds like a great event. So, Dr. Peters, I'm afraid that's all the time we have, but so thank you so much for joining us this morning.
Oh, glad to be here. Thanks for having me.
Okay. Well, for